Good afternoon. Welcome to KIT Royal Tropical Institute. It's great to have you all here and online here and present at KIT, but also mostly online. And we hope to provide an interesting seminar this afternoon with lots of opportunities for Q&A and participation, also through a panel which is going to be here. We organized the seminar together with HealthNet TPO, who are, as we have been and are still active in provision of health services in Afghanistan. Also welcome to the panel who are going to be here, sitting here later on. KIT started in 2015 to become involved in the Afghanistan health system. We had the job of third party in the system, which meant gathering of evidence for the quality and development of the provision of services. That meant that every year we had hundreds of people going into the country and talking to patients, to the inhabitants, to everywhere in the country about the quality of the services they were getting. And this was something which was, of course, sometimes often at risk for the people who were going there. Some of them were even kidnapped, and so a tough time, a tough job to do. But we saw progress in the whole system, which was great. So KIT was committed to the health system since 2015. Later, we joined up with Partnership as a partner in this job. We are very committed to providing this making sure that the health system works. And at this moment, there's great risk that the health service is not continuing. So lots of lives of people in Afghanistan are at risk even in this winter. Problems are money. The previous work done by the NGOs and by us was paid by the World Bank, and the World Bank stopped funding. Now, there have been found some temporary solutions, but that is not sure to continue in the coming months. So we want the seminar to take place and to make sure that we can discuss possible solutions. We hope we can contribute to that through this seminar. It's not only going to be a serious seminar, we also have music here, poetry, so I hope you will enjoy the afternoon. Thank you very much. Then I introduce you to Egbert Sondorp. He's our colleague who has been working both for KIT and for HealthNet TPO in Afghanistan. He's very aware of the situation, and so Egbert, please go ahead.
Most welcome to you wherever you are. It's afternoon here, it's getting almost dark. And it's great that you could all join, also the few people who are here. Unfortunately, we could not have more people today because of circumstances, but it's great that we come together. And I think it's good to realize what brings us together. There are some major concerns about Afghanistan, as Mark already alluded to. And I think it's a lot of it. And it's about the political side of things, and it's about human rights, in particular women's rights. But also it's about the economy and the mass starvation, as they already call it now, and some people already start talking about famine. These are all horrible things which happen, will continue to happen, and we don't know what the outcome will be. But today let's focus on the health services, because also they are affected heavily, and we know that we have been building up health services over the past 20 years, likely to go down, but what can we still do to prevent things to getting even worse? And that's what we want to do today, to think through, are there things which we can actually do, despite all the dilemmas that it comes with? So we want to reflect a bit on the past, but in particular look forward to see this is what we can do, this is the downside, but okay, let's go for it, or let's advocate for other people to come and join. Of course, it needs a lot of money. You'll see in the presentations how much money, in fact, is needed to keep this going. So I think we're also here together, not only because of those major concerns about the country, but also about, let me say, the love for the country. And I'm sure the Afghans will undoubtedly share this despite what happens, but also for us in the international community. We have something with Afghanistan which makes us keep going back. And it also concerns us now. So, and I think I always wonder, why is that? Why are we so committed to this particular country, maybe more than others? And my only answer is it's something with the Afghans and something with Afghan culture. So that's why I'm so pleased that we have today, you heard already some music, but also we hear a poem. I think that's part of that culture, which we also would like to share. So let's quickly start, because the program will be full. So you hear people talking very swiftly and short. We also like your contributions. That's why they talk so fast and short, so that you can comment and ask questions through the Q&A system of Zoom or whatever you are linked to with us. So I would like to invite our first poet. It's Tanya Afeki, if I pronounce it right, and she will address us.
Goedemiddag dames en heren, ik ben Tanya Afeki, ik ben dichter en mensenrechtenactivist. Ik ga een gedicht voordragen in Farsi. Die gedicht is in mijn eerste boek uitgegeven 2014 in Afghanistan. Geboren in Khorasan, getogen in Nederland. Gedicht draag ik eerst voor in Farsi en daarna de vertaling in Nederlands. عصرتان بخیر، تانیا عاکفی هستم، شاعر و فعال مدنی. شعری که بهتون میخوانم در کتاب خراسان زاده این الزمین، کتاب نخستم در کابل به چاپ رسیده. اسم شعر از عروسک بازی. این شعر به تمام کودکان دوشیزنما که ناخواسته در عقد یک مرد بزرگسن میرن و یا مسئولیت های یک زن به دوش میگیرن. عروسک بازی. کودکم کودک دوشیزنما، بوی شیر از دهنم می آید. نه دروغ است مگو، مزه شیر و کام من بیچاره نشد. یاد من هست دو پستان عزیز مادر، دو تا بازیچه دستان هوسبازی بود که خود از جنس نران بود ولی مرد نبود. کودک نافرمانی که خلاف امر قانون خدا، پسر خواسته مادر و بابا نشدم. جنس زن بودم و دختر به زمین آمدم. ناف بیمیر مرا چو بریدند ز مادر، هوس مرگ مرا ز خدا خواستند. کودکم دخترک آن طرفم که عروسک بازی رسم دیرینه ماست. ما عروسان مقوایی را شامل بازی خونین شب عقد و نکاح ننماییم. ما عروسان 19 ساله هدیه سازیم به مردان 40 ساله خود که عزیزند به ما. De vertaling van het gedicht is: poppenkast voor alle onschuldige kleine meisjes die ongewenst de rol van een vrouw moeten vervullen. Ik ben nog klein, een jong klein onschuldig meisje. Mijn mond ruikt naar moedermelk. Nee, dat is niet juist. Ik heb nog nooit de moedermelk gesmaakt. Ik herinner me vaag de borsten van mijn moeder, toen plotseling op een donker, onbewaakt ogenblik een verdierlijke zich hiermee vermaakte. Hij leek een vader. Ik ben een meisje. Een opstandig meisje. Tegen alle dogma's in ben ik een meisje ter wereld gekomen. Niet de gewenste zoon van mijn ouders. Wanneer mijn navelstreng werd doorgeknipt, waren ze schaamrood. Ze wensten mij dood. Ik ben klein meisje. Verschenen uit Verre Oosten en het verdoemd poppenspel van de huwelijksnacht in mijn maagdelijkheid gebruiken ze mij. Onze lieve 10-jarige meisjes worden cadeau gegeven aan onze 40-jarige mannen. Bastaards die wij graag lief hebben. Ik hoop dat het aandacht komt ook voor kinderen die onder uw leeftijd van 18 jaar uitgehuwelijkd worden. En alle rechten ontnomen worden als mens. Dank jullie wel.
Thank you so much, Tanya. This was a very moving bit of poetry. And of course, you could not hear, those English speakers among you could not hear. She first read it in Farsi, I suppose, and then later on in Dutch. I can't translate, I will not translate, but it was about a small child and her perspective of living in Afghanistan. It's a very short summary, and it was not a very nice picture, I must say. So let's move on and go to a presentation. We want to reflect on kind of things which have been done over the past 20 years, but that also should lead us thinking towards the future. And we have one presentation, two speakers, and we're very happy to have Dr. Majid here. He has been for 15 years, he has been the head of mission of HealthNet TPO in Afghanistan. And HealthNet TPO was one of the larger NGOs providing health services even before 2001 and ever continuing up to today, I assume. He is here with us today, and he will share the floor with Margot van Gurp, who is a KIT epidemiologist, and she is part of the team here, which is doing a lot of data analysis, a bit behind the scenes always, but for all the data we are collecting as part of the third-party monitoring work for the health system in Afghanistan. So I don't know who is going to talk first. Majid.
Good afternoon. This presentation is mainly we will be discussing the very, very important issue, critical issue that Afghanistan is facing. And as it is the title of this presentation, Afghanistan health system on the verge of collapse. Are we in the verge of collapse or not? Yes, it is what is happening. Last few months, we are facing a very critical situation. So this presentation will give an overview of what is happening currently and what should be done. That is a few ideas, and then we will have some question and answers. Looking at Afghanistan, what is happening, it is the socio-political situation last 42 years, which is affecting the country. It starts from 1979, where the Soviet Union invasion started, and we were facing a decade of war and resistance in Afghanistan, and that resulted in collapse of every social system, that including the health system. And that resulted also 2 million people were killed during that time, and also half of the population displaced to neighboring countries. Then from 1988, when Russians, Soviet Union that time withdrew, there was civil war till 1996, where Taliban took over. Between 1996 and 2001, that was the era of Taliban, and where there was a total ban on recognition of the Taliban government, and much was not happening. Then we had these 20 years of 2001 and 2021, where there has been development, and there is in all sectors, including in the health sector, we had. So what was happening in these 42 years was the health system, the healthcare and service delivery was severely affected, and where mainly the urban health was taken and services were provided by the government throughout these 42 years. But rural area was, which is 25 to 80% of the population they are living, they were affected. So during 80s, not much was happening, and there was no functional health system in rural areas. And during 90s, that decade of 90s, the NGOs started establishing a health system. But it was only possible to cover around 15% or 20% of the population. And that was also very basic services. But what happened last 20 years from 2021 to 2001 to 2021, there was drastic changes in the health system. What you can see is currently there is around more than 2,500 clinics and basic health centers, that is the primary health care, and more than 69 hospitals were functioning, where the NGOs played an important role. More than 80% of these facilities are managed and run by NGOs. What was major achievements during last 20 years? If you're looking at important aspect was which Afghanistan was facing during 2001 was the human resource, and especially the female staff. Beside that, the infrastructure, equipment, medicine, vaccination, governance issues, financial issues, and the policy and strategy. But there had been significant achievements. For example, if looking at the human resource, there was certain innovations like community midwifery, community health nursing, and focus on female staff. And we had nearly 80 to 90% of the health facilities, they have staff, female staff. And so there has been a significant achievement in the human resource beside other category of health workers. 60% of the health facilities now, around 60% have the buildings, their infrastructure, and most of the, nearly 100%, they are properly equipped. We have steady improvement in the vaccination coverage, and has improved significantly during last 2 decades. But important has been, there is a lot of research and evidence-based approach, where the policy and strategies in all aspects, and the management and the governance, there had been contribution from NGOs, contribution from international organizations, and we had drastic changes where a system was established and functioning. I will come later slides on financing and access, but the innovation and quality has been key for us in the health system in Afghanistan. That was the quality assurance mechanism, the third party, which was KIT was doing on accountability and transparency and quality issues. And there was a number of innovative approach to reach the women and children, which were the most vulnerable group. That is the home-based approach, and we had on public-private partnership and other approach we had. Looking at the access, that is nearly 90% of the population has within 2 hours distance can reach the public health services and access the health services. That is compared to 2001. It was around 10 or 15% of population which had this access, and they were availing the health services. So especially the primary health care, and especially the rural areas, we had significant improvement. This is the important aspect, which is this slide. If you're looking at the funding mechanism, that is what is now the challenges. That is the critical. The main funding was coming from the donors, around $420 million per year. And out of this 420 million, 150 million was going directly to the primary health care and BPHS, basic package of health services, and essential package of hospital services. So the backbone of the health system is the primary health care and secondary and tertiary, which was run by the NGOs, mainly 90%, but recently now, last few months, other provinces also added to the NGOs, and they're fully running this system. And that has been the key, and that is now last 3 months with takeover of Taliban. That is the freezing is coming, that is the challenge. But we had 320 million for other projects, like from Global Fund for malaria, TB, and HIV/AIDS, Gavi Alliance for the immunization. We had polio eradication, and then there was off-budget technical assistance for USAID, European Union. There was mental health, disability. So there was a number of other projects. But the government budget was also significant. 120 million was per year, mainly used for the administration and for the Kabul and some other hospital management, which is also now not available. So what this 150 million was coming, that was part of the USAID, European Union, and World Bank contribution. So this was happening from 2001. Even before 2001, there was funding from these, especially European Union and USAID. But they had a pool funding to fund the primary health care and secondary health care. And with the changes which happened in 15 August 2021, that is freezed. So that is a total system collapse. And for months now, we have day to day have to find a solution to run the hospitals and clinics. Looking at what was happening with fall of the government 15 August. So what was till June, the World Bank had funding for NGOs that is not paid. Already contract was there, but still that cash is not transferred, so salaries are not paid, and the same thing is happening. July to September, where there was extension of this contract, nobody is taking now responsibility. There is supply of medicine and there is salaries to be paid, but there is no clarity yet. Looking at October, there was 1 month funding that is through UNDP by the Global Fund. There was only 1 month funding. And there is now another 3 months funding through WHO, which is happening from November to January. But what should be done now? We have these 1 month, 2 month, 3 month, and partial, and also backlog issues still pending. There is important that from Europe, we have to look at the European Union, the countries, those who are funding this pool funding, or the Afghanistan Reconstruction Trust Fund, that includes the Dutch government. They have to look at how they want to finance the health system in Afghanistan, how to avoid the collapse. So, yeah.
Yeah, so let's have a look at what has happened in the past 20 years in terms of achievements in health outcomes. Because a large part of the public health system was extensively monitored during the past 20 years. And through this process, a lot of data has been gathered, which can be used to assess what has been achieved in the past 20 years. And as Mark had already mentioned earlier, KIT has been involved in that process since 2015. So in 2001, Afghanistan was dealing with one of the highest maternal mortality rates globally. Approximately 1,400 maternal deaths per 100,000 live births, as compared to a little over 300 globally. That means that Afghan women were 4 times more likely to die during pregnancy, during childbirth, or shortly thereafter as compared to women globally. And this is one of the reasons that a lot of investments have been made in the public health system. One of these investments is about increasing the number of health facilities, simply because increasing the number of health facilities could help people who did not have access or could not afford health services, to bring these services to them. And so since 2004, where we had a little over 1,100 active health services, this has increased to over 2,500 in 2021. So this increased by more than a twofold. Looking at it per capita, we can see that it's an increase from 4.6 health facilities per 100,000 population in 2004 to 6.5 facility per 100,000 population in 2020. And not only were there investments made in increasing the number of health facilities, they've also invested in better equipment or better equipping these facilities. Because if a facility doesn't have the resources, then they can also not provide the services to their communities. And so what they've done over the past 20 years through annual health facility assessment is checking what resources were available. For example, by looking at the availability of essential medication. And in 2004, the first round of this assessment, it was estimated that health facilities had approximately 77% of all essential medication available. We drew the same conclusion in 2020, where we also found that an average availability of 77%. And now this doesn't maybe look like an improvement, but it's important to realize that at 2 moments in time, 2011 and 2018, the assessment changed, mainly in terms of the number of drugs that we had assessed. And so if we're only looking at the number of drugs that were assessed in the first period between 2004 and 2011, we can actually see an increase to 93% in 2020. The improvement over time for essential equipment is more evident. In 2004, on average, facilities had 68% of essential equipment available. Think of delivery kits or blood pressure cuffs. And this increased steadily to 91% in 2020, despite similar changes in the assessment. But the most considerable increase was observed for laboratory services, where 34% of essential laboratory services were available in 2004. This increased to 88% in 2020. So not only did we have more facilities, the facilities were also better equipped. And the idea is then, of course, that more people have access to essential health services, including pregnant women who benefit greatly from services like prenatal care. Because if a health provider can diagnose and treat signs of complications in a timely manner, this is beneficial for the health of the women. Approximately 16% of maternal deaths in low and middle income countries result from high blood pressure during pregnancies. And this is something that can be quite easily diagnosed, and it's also treatable. In addition, it is also a moment for the pregnant woman to obtain information on healthy behaviors during pregnancy and to get vaccinated. Another essential health service for pregnant women is skilled birth attendance, because one of the major causes of maternal mortality is severe bleeding. And skilled birth attendants, like nurses, midwives, and doctors, they are trained in handling uncomplicated pregnancies. Now, if we want to know whether these investments in healthcare infrastructures have also improved access to health services, we look at health surveys. Because during these health surveys, they ask women who had a live birth in the past 2 years whether they have received certain services, like prenatal care services or skilled birth attendants. And if we look at if we look at these health surveys between 2003 and 2020, we can see that for both prenatal care and skilled birth attendants, there is a very clear increasing trend. So more and more women are getting essential health services during their pregnancy. But we're not there yet. Because if we compare it to Pakistan, or if we compare it to South Asia and the world, then we still see that they are, underperforming as compared to those areas. So there's still room for improvement here. Now, with this improvement of coverage, we of course also hope to see an improvement in health outcomes for mothers. And so in 2001, an Afghan woman was 4 times more likely to die as a result of pregnancy-related complications as compared to women globally. But in 2017, we can see that the mortality in Afghanistan has more than halved, from almost 1,400 to 638 maternal deaths per 100,000 population. And instead of having 4 times the risk of dying from pregnancy-related complications as compared to women globally, Afghan women have now 3 times the risk. And of course, this is still unacceptably high, and women really shouldn't be dying at this rate from things that are preventable. But still, it is also a lot of good progress that has been achieved in the past 20 years, and we really cannot afford to lose that.
Okay, so we are coming to the last 2 slides, and first one is, so what is the current situation has the impact on the health sector? So what is at stake? So we had billions of dollars investment during last 2 decades in Afghanistan. To see the impact what was presented in improvement in the health indicators, and we had a reduction in maternal mortality and child and infant mortality. We have seen a system established and a system functioning, and there is improvement in coverage and access and quality. And especially the women and children, which is around more than 80–85% of the total consultation, they had access to the health care. So that has been what is achieved, and that is now at stake. What we have to do, that is this symposium is, and that is what we want to achieve, and we want attention of the European Union, the Dutch and international donors, the World Bank. We have to take action urgently, otherwise we will be facing a collapse of the health system, and that collapse, if revive it, that may be too late if you are waiting for another few months. We need to ask the Dutch government and the EU, which is funding the health system and health sector for decades, they have to find innovative ways, and beside other donors, through UN and through the international and national NGOs, to continue the implementation of the health services. So that is what is the way forward. We have to act now, we have to act quickly, and we have to find a solution to the current situation. The sanction and other issues which are happening in Afghanistan should not be hampering the health system, and what should be achieved should continue. So with this, I'm ending this presentation, and back to you, Egbert. Thank you.
Thank you, Majid and Mago, for this overview of 20 years and your plea that we have to act. A couple of questions came in through our system. We have decided to only ask one to you. The others we will reserve for the panel debate. But I think there was one, I think, a very pertinent question asked by our colleagues, NGOs in the Netherlands, or someone from Cordate, but they are very interested. What is the situation now? Do you know that? Do you know how many clinics, how many hospitals are still running? How many health workers are still there? Are female health workers still working at the moment? this kind of questions? Maybe you have some idea.
Difficult question also. One is it is functional health facilities. What was functional is still it is functional. But how it is functioning, that is the question. Because of lack of medicine, lack of payment of salaries, lack of motivation, and something is waiting. They are waiting what is happening, what is the future. So there is difficult for NGOs to keep their staff motivated and ask them to continue to work without payment, without running costs, without the other facilities. So it is functional, but semi-functional, and they are anytime. If it is a permanent solution is not there, they have to leave. And then there will be a total collapse.
Thank you. I think what you highlight, we'll soon have an opportunity to actually see some of it. So I would like to thank both of you. And we'll get back to some other questions during the panel debate later on. But before we reach the panel, we would like to show you a documentary. And I think you can see it's a short documentary, but from very recent footing from within Afghanistan. And you'll see, I've been working a bit with someone I'm seeing there, but on the drugs provision in Afghanistan. And up to recent, it was not so bad, but you'll see how it looks now.
For 20 years, Afghanistan's healthcare system has been strengthened and improved with support and funding from international NGOs and donors like the World Bank. Between 2002 and 2016, the number of functioning health facilities increased fivefold, while the proportion of facilities with female staff increased from 22 to 87%. For instance, managed by HealthNet TPO, the Afghan Japan Hospital in Kabul and Nangarhar Regional Hospital in Jalalabad see more than 600,000 patients every year. However, endorsed by ongoing financial contributions, the system has become dependent on these actors to survive. Now, with all financial support halted and a mass exodus of trained personnel, the health system we've worked so hard to build is on the brink of collapse. Health facilities across the region have closed their doors to all but emergency patients.
وضعیت کنونی که شما می‌بینید در شفاخانه نسبت به سابق بسیار زیاد تغییرات بارز در اینجا ما می‌بینیم. سابق بودجه مشخص بر ما به دست داشتیم و پول کافی به دست داشتیم که مثلا ما می‌دانستیم که به شکل ماهوار خریداری دوای خود کنیم مطابق ضرورتی که چقدر مریض داریم و چقدر دوا نیاز داریم. ما با کمبود شدید دوا مواجه هستیم. ما با کمبود شدید سپلای طبی که اکسیژن که یک ضرورت مبرم است بر مریضای کرونا ویروس ما فعلا با کمبود اکسیژن ضرورت داریم. اگر کمک‌ها بر ما نرسه فعلا دروازه شفاخانه حداقل برای مریضی که به حد ضرورت داره واز است و شاید در ظرف یک دو ماه شفاخانه برای مریضای ضرورتمند بسته شود.
هر څه به موږ ته همدلته د خپل ځانه کېده یعنې موږ به هېڅ شی هم نه کول اوس چې دی موږ خپل هر څه په خپله په پیسو اخلو دولتي شفاخانې ته مو لږ سترګې وې اوس چې دولتي ته راشو په دولتي کې مو هر څه په خپله اخلو شخصي نه بدتر شوي دي
مشکلات اقتصادی رخ داده که ما بدون معاش در اینجا مزدور بی‌مزد هستیم اکثریت پرسنل در اینجا به نانآور خانه خود می باشند و مسئولیت فامیل خود به دوش داره و در این مدت که یا معاش نگرفتن به مشکلات مواجه میشن که خودش یک تشویش روحی بر خود و بر پرسنل ایجاد کرده
An annual $400 million was provided and was committed for the upcoming years to sustain the current health situation. Without access to this funding, the health system is poised for collapse.
جنگونو په نتیجه کې دا کلینیک د دولت قواو له خوا نه بمبار شوی هم ده، په توپونو ویشتل شوی ده، په بمونو مولوزول شوی ده، چې په نتیجه کې ډېر مالی خسارات د کلینیک ته اړولي دي. اوس خدمات د خلکو پر مخ د مریضانو مراجعه کلینیک ته او د منګه خدمات د دې جنګونو د دې ویرانیو له وجې نه کم شوي دي.
What the international community can do is to not to disengage from Afghanistan. Disengagement is not the solution. The only solution of problems that we are currently facing is to engage with Afghanistan, with the Afghan people. My message to the international community is that please don't disengage this 35 million population of Afghanistan. Don't disengage from this geography which is called as Afghanistan. We need international engagement in this country, and together we can make or we can create solution for our current problem.
سالها زجر کشیدیم، سالها در شرایط سخت درس خواندم، در شرایط سخت کار کردیم، در سخت‌ترین شرایط شب و روز ما کار کردیم و یک دستاوردی داشتیم و این دستاورد هم منحل میشه و سیستم صحت ما به زودترین فرصت از بین خواهد رفت.
The current situation cannot continue for much longer. Personnel need to be paid and supplies need to be bought. If the lack of funding and the subsequent lack of supplies continues, we will see more hospitals closing and preventable deaths rising. According to the World Health Organization, the suspension of funding to the health sector will lead to a daily rise of 100 maternal deaths alone. On behalf of the Afghan people, we appeal for the continuation of humanitarian support and assistance, especially to the health sector. We appeal to the international community to keep their commitment in Afghanistan, to save lives and bring hope to all those who are holding up the health system at their own expense.
So thank you for whoever was preparing this film and had the courage to go there and make this available. I think it gives you a bit of more feel of what's happening there. And of course here we still saw the situation in cities, which are always a bit better than probably at the countryside. There was a saying in the movie, this person who was talking said, please do not disengage. And I think we all want to be engaged. But the big question is how? How can we be engaged? And I think that's very much the topic of the panel, which is coming. But first, before we go to the panel, we have a break, around 10 minutes. We're very happy to have, I don't know if you're together, called Khalil Sadiq. That's what I have, yes. And they will play for us. The way they come here, I heard some weird stories about a weird road movie that led you here, but you just arrived in time. We're very happy for you to play to us over the next 10 minutes. After 10 minutes, we will continue, and then we'll have a panel debate. Please.
Bazaar.
Great, that was fantastic. Not the usual sound that I was hearing when in Kabul, but this is probably what you all grew up with, and nice music. So let's continue our program, and we have the panel, as already announced. We'd like to visualize what maybe is possible in a pragmatic way. And we all acknowledge the various dilemmas, and I'm sure they will come in the various responses of our panel. But let's listen to it and see what it brings us together. So we have 6 panelists, and we have asked each of them a specific question linked to their specific field of expertise. We've also asked them to be short, so that we have a bit of time to go over some questions which you may want to pose through the Q&A system at your Zoom system. What I will do, I will give the 6 the floor, one after each other. They talk for about 2 to 3 minutes around the question we ask them to give, and I will give a short introduction to each of them when they start. And it's my big pleasure to first give the floor to Pashtun Aswa Ziyeh. She is the founder and advisor to the Afghan Midwives Association, which is established in Afghanistan in 2005 to give the voice to midwives and regulate midwifery programs in the country. And I think it has been one of the major achievements of the whole past 20 years to have this huge cadre of midwives, and it needed some good house. And I think Pashtun has been very much instrumental in doing so. So, Pashtun, could you tell us what you think about the current state of affairs towards the function of the midwives, and how you see them, how they could be supported to continue to function?
Hello, everyone. Good afternoon. And thank you very much for giving me this opportunity to share a little bit with you regarding midwifery in Afghanistan. As Dr. Majid and the presenter, they actually give us quite enough information about the construction of health system in Afghanistan, which midwifery was part of that. So with the reconstruction of the midwifery, including education and service provision, lots of effort put together to make it very, very successful. And again, in the presentation, the dramatic reduction of maternal mortality in Afghanistan. So I would say that with the hand of midwives was very, very instrumental to that success. It was not just to build the system of midwifery education, for example, curriculum or other related things, as well as the standardization of the hospitals where the midwives are practicing their clinical practice, so that the accreditation system established. So midwifery, it was not just in 1 or 2 provinces, it became a national system in all 34 provinces of Afghanistan. So a midwife in Khost or Kabul, there was no difference between their capacity, knowledge, or competencies. So lots of achievements. I don't want to talk more about the achievement because it has already discussed. But regarding the establishment of Afghan Midwives Association, as you kindly mentioned, that it gives the midwife voice, and as well as a power house of ideas, capacities, leadership skills. So it became a focal point for the profession, for the advocacy, a gatekeeper for the quality of services. So much achievement, especially in terms of advocacy. So, you know, now in 2019, the Afghan Midwifery Nursing Council established after 9 years of advocacy by Afghan Midwives Association, or the first ever advocacy for to have a safe motherhood day and activities related to that safe motherhood, or I cannot really even list all achievements that the Afghan Midwives Association in the last 15, 16 years achieved. But bridging program as a professional development opportunity for the midwives, which would really address so many issues related to the midwifery profession. And now, as again we saw in the movie, we heard from the presentation, so when the health system is collapsing, definitely midwifery again is part of that. It's going to be collapsed. The Afghan Midwives Association just did a very short, small survey, just 3-4 days back at the end. And so mothers are dying because there is no oxygen, there's no medication, there's no ambulance. If there's ambulance, so the referral tertiary level hospital also doesn't have those supplies and equipment that can save the life of the mothers in newborns. And small thing, for example, it is not just for the mothers as well as for the newborns. I heard from one of the midwives that it represents the Nuristan province, and Dr. Majid knows those program and midwives very well because they supported their education program. So the midwives of Nuristan went approached the provincial health director or team of Nuristan province, not asking for their salary, which they haven't received for a few months. They asked for fuel or wood fire to heat up delivery rooms. Now, most of the babies could be die due to cold nursery or delivery room. And the midwives suggested just the first thing we need, besides the oxygen, we need to heat up delivery rooms, which is there is no fuel, nothing. So if we see all these challenges, and so some of the midwives, they leave their profession because they don't have their clinics collapsed, stopped activities. In Kabul, one district, the midwives, they go to the hospital. They want to continue to work, but again, there is no supply. We say that midwives can provide 87% of maternal health services if they are well supported, well educated, and working in enabling environment. And now it is not the issue of enabling environment, it's that at least working environment which has some supplies, some medication, something to function. So this is the situation, and I hope that with this symposium, which I'm really want to thank KIT University and the organizers for such a great job. I hope the result also be such a beautiful and warm as the atmosphere of the symposium.
Thank you very much for this account on the situation on your side, on the midwiferys, and the program which is evolving. Let's quickly move on, because as I said, we have limited time for this, and we would like to hear some questions answered which come in through our Q&A system. And welcome to Salehi. Good to see you again, by the way. Salehi is a former advisor to the Afghan government. He is an Afghan public health specialist, a health economist, and a senior researcher. And he has had a whole range of important jobs in Afghanistan. Currently, he's not in country. He's been advisor to the Minister of Public Health, head of international relationships, head of grant and contract management units, and head of health economics and financing. So, surprise, surprise, we will ask him some questions about how do you see the finances? Can you confirm that the system was so dependent on external funding? How could you see that it could ever be replaced, not only now in the short run, but also in the longer run? And a question which I personally always have, the new government, do they have any money? They have some money to fight, but do they have any money that they may want to spend on the health system?
Thank you, Egbert. Hello, everybody. It's really a privilege to be a panelist here in this important symposium. Thank you for the invitation. To be brief, Egbert, yes, Afghanistan's health sector is extremely dependent on funds of international donors. Other presenters provided a clear picture of the financing situation in the past at least 2 decades. If we look at the data, data shows that 85% of the total public funding has been paid by donors for the past 2 decades. Frankly speaking, I'm very much worried about the probability of a systematic funding gap to maintain at least the essential health services. We have had lots of achievements. Without funding, I think we will not be able to maintain it. I'm also concerned that the humanitarian financing, which is happening right now, might be too fragmented and sanctionalized that that it might forget the notion of a holistic approach. The question of how can a long-term sustainable health financing be ensured in Afghanistan, I'm afraid we do not have so much financing options here, except to urge donors to resume funding their services. Of course, domestic resources could be an option in future, but I would rather not speaking about it here at this stage, because it's not a promising option at all. I think apart from financing, there are some other key elements that should be considered to ensure sustainability in future at this stage. One is to make sure the design of the humanitarian assistance respects the available systems and local ownership in order to allow a linear transition to the development phase once the crisis is over. I can also talk about establishing joint humanitarian and development offices, creating operational frameworks that could incorporate a long-term perspective into humanitarian work. I can also say about strategic partnerships instead of project grants, joint assessments, and accountability frameworks. Otherwise, I think if it's not well designed at this stage, humanitarian assistance might be very messy with numerous gaps and overlaps and other types of inefficiency without vision for future sustainability. Let me sum up my messages. First, yes, Afghanistan's health sector is dependent on donors. Second, there is no other option except to seek donors' assistance. And third, the current humanitarian assistance requires strategic design to ensure that local ownership, including use of local humanitarian resources, is considered carefully for future sustainability. I stop here. If there is any question, I'm happy to answer later on. Thank you.
Thank you very much, Salihi, for this clear message. And we'll get back to you if there is any question. I'd first like to reintroduce Dr. Majid. He has already spoken to you earlier. Dr. Majid has been 15 years of head of mission of HealthNet TPO in Afghanistan, providing to many millions of people. It's so difficult to imagine. NGOs usually think of quite small entities, but in Afghanistan they're huge. They provide health service to really millions of people by each NGOs, which Dr. Majid and HealthNet TPO has been done. But not only the health services, they also put a massive effort in psychosocial care, and I think a lot of the psychosocial care system in Afghanistan is also introduced and maintained by HealthNet. Dr. Majid is a medical doctor. He has a master's degree in health systems management from the London University and 20 years of experience beyond even HealthNet TPO in leading other national and international NGOs in the country. Dr. Majid, could you talk a bit about the role of NGOs in Afghanistan and how you see that they could continue to work?
Thank you very much. First, nice to see Dr. Salihi and our colleague, ex-colleague, and we work together, Pashtun. So I think it is critical situation. Sad to be in here and we are talking. A few months back, me and Salihi, we were talking about the financing system for long-term for Afghanistan. There was a strategy was developed how to come out of dependency on donors. So it is sad to be back where we were a few years back or 20 years back. But NGOs has played an important role for many decades. And what I can see is now it is very critical because of political situation, the humanitarian crisis in Afghanistan, that NGOs should be coming together and should be ensuring that the healthcare continues and the services are provided. I think one of the aspects that in Afghanistan, through Alliance of Health Organization, there is a lot of advocacy is going on. That is to lobby and advocate and communicate with World Bank, USAID, European Union, and other donors to ensure there is continuation of the funding and the services. Currently, what is happening, every day, NGOs, they are facing multiple challenges to continue to keep the clinics and health facilities and hospitals open because of running costs, because of even the fuel for generator if it is not there, how to run a hospital. And sometimes they're asking individuals, UNICEF, WHO, and others for the fuel. And medicine is another problem, and also we are looking at the salary, which is not paid. So these are 1 month contract and 3 months that is happening, but NGOs should come together, and also from the European, from the Netherlands, the NGOs which are active in Afghanistan, that should be coming together also and try to advocate and lobby to ensure the funding is coming to the Afghanistan. But I agree also with Sally, Dr. Sally, that there should be a proper mechanism. We are in humanitarian, we are in the crisis, but we should make sure the efficient use of what is available. And especially the backbone is the primary health care, which is called BPHS and APHS. That should be the first priority, and that should be supported. And one of the major problem I can see is that is the short term we will not see, but if the situation continues, what we achieve in terms of mother and child health, the maternal mortality and morbidity, and also the infant mortality and child mortality, there's manifold decrease. So that we will be going back to the 2001, and that will be the same situation, the coverage, the health indicators, and the service delivery. So I see as NGO, we are facing challenging situation in the country, and that should be an advocacy role we have to play now at this point of time. Thank you.
Okay, Manjit, I think you already started your advocacy role by talking here. Thanks for that. Next speaker sits next to me. We call him Nasrat. Fuad is Nasratullah Ansari. He is a sexual and reproductive health and rights and maternal and newborn health expert, independent consultancy in the Netherlands now. And he is a former country director of GPIGO, Johns Hopkins University in Afghanistan. And of course, we would like you to answer a bit about the field of sexual and reproductive health. What's your perspective on that?
Thank you. It's nice to be here, and it's my privilege to talk about Afghanistan. In the last 20 years, the focus of technical assistance programs was maternal and newborn health, generally reproductive, maternal, newborn, and child health. And these programs were mostly funded by large donors like USAID and World Bank and European Union. So because of that, we could see the improvement of maternal health, maternal newborn health. And more women and more newborns and children had access to healthcare. So in addition to that, the quality of care was improved. And it was the focus of the, particular focus of the technical assistance programs. And because of that, tens of thousands of health workers, including midwives, nurses, doctors, pharmacists, were trained and their capacity were built. And because of that, the knowledge and the skills were built. And then we could see the quality of care improved. And then based on several assessments that we conducted, we could see the improvement of quality of care in health facilities and hospitals. So one of the results of those programs that Pastor John has already mentioned was the midwifery education programs. So that has a large impact on improving, increasing access and improving quality of care. So in addition to quality of care, the technical assistance programs, particularly on reproductive health, reproductive maternal and newborn health, was focused more on health system strengthening. It means that the access, coverage, and quality of care was the focus of those programs, and funds were spent in those areas, and in addition to that was efficiency. In the last 20 years, we could the numerous policies and strategies and guidelines were developed by supported by international community and funded by them, and of course the engagement of Afghan experts. So I cannot say all of them were implemented, but many of them were implemented, and we could see the result. And so the access to healthcare increased, and quality of care improved, and more women, the coverage of health services increased. And in addition to that, one of the building blocks of the health system was the health information. So we could see the improvement, the establishment and also expansion of the health management information system, HMIS. And recently it was digitalized. So it's a great achievement for the health system. In addition to that, improving of the health workforce and leadership and governance, and access to essential medicine, increasing the service delivery to all aspects of the 6 building blocks were improved. And the aim of those programs were to make the health system fully functional and resilient. And somehow we were working towards that direction. But suddenly, the collapse of the government and freezing funds was made everything in pause. And now we can see the health system that we built is trembling. And the quality of care is declined, and access to essential medicine and health facilities is declined. And now millions of women are facing with challenges to access to healthcare. And not only women, but newborns and children. And also the most important thing is the reproductive health. It's also facing with so many challenges. So if the freezing fund continues, we can expect the pillars of the health system will be collapsed. So the international community should think about it and immediately release the funds in order to make the system running. And one more important thing is access to healthcare is the basic human right. So any political dilemma, I mean, the human rights should not be compromised with any political dilemma. So women, children, and newborns, and also all the population should have access to healthcare. Thank you.
Thank you, Nazarat, again for this clear message and alluding to the human rights, which are so much at the heart of our thinking of what we can do and should do, and how we can circumvent certain circumstances. But let me now go to Dr. Kamil. He is away in Cairo, as I can see. Dr. Kamil is a program area manager for the emergency operations in the WHO regional office of the Eastern Mediterranean, EMRO. And we know that he is in charge of setting up, or probably already in operation, initial support activities to channel funding and also to make things happen again to the extent possible. And we are very curious to hear how far are you with your plans and how do you see this evolving over time? Dr. Kamil.
Good afternoon. Thank you very much, colleague, for this invitation. I think this symposium is really well in time, so it's an opportunity for us to exchange. Are you hearing me?
Yes, yes, we do.
Okay. So WHO has many of other UN agencies decided to stay and deliver as much as they can during this really unfortunate period for the people of Afghanistan. So there are two major areas where WHO is working. One is the usual, may I say, areas of our intervention, which is responding to the emergency situation. As most of you may know, currently Afghanistan is facing multiple outbreaks of measles, dengue, water diarrhea. It's already cholera, although officially it's not declared by the current authorities. And of course, the ongoing COVID pandemic. So we are providing support to how to deal with this outbreak currently. In addition to that, we know with the pause of different fundings, we knew that the country will face issues with the supply. So we have not really yet established functional systems. You know, there is issues with transportation to Afghanistan. Thanks to so far to Qatar's and to WFP, we have been able to channel at least since 31st of August, commodities, essential medicine, and distribute into the different provinces for about $5 million. And actually, we have already developed and we have secure fund for the next 6 months, at least to procure and to make available essential supplies for all the health facility, including Sihat Mandis areas. With the Sihat Mandis, I think with the pause of donors, particularly the World Bank, EU, and USAID, we were all of us, in a situation where we may end up with the situation that our colleague now here was describing, the collapse of the systems. So we say as of now, thanks to the different partners, donors, UNDPs and global funds, they have been able to, let's say, start the process of stabilization for 1 month, for October month. From 1st November, we secured UNICEF and WHO together. We have agreed, and with the support of humanitarian funds, we are funding now on the 34 provinces of the countries. For your information, we are using the same NGOs which were used under Sehat Mandis, under the World Bank projects. So we are not recruiting the new NGOs. We have not changed anything. The same scope of services, the same NGOs, the same distribution. I mean, the areas of work, as well as also we have maintained the third-party monitorings. The only things that we remove from that is the pay for performance component, because we thought maybe for these 3 months it will be difficult to deal with that. We are actually in a discussion with the World Bank, promising, may I say, where the World Bank will provide through the mechanism that they call transfer out funds for UNICEF and WHO to sustain the services until end of June 2022. This gives us, at least together with the partners, NGOs, and the international communities, time to think about the future of the health system in Afghanistan and how to secure funds. So in terms of, I hear what one of our colleagues say, that there is a need for humanitarian assistance to be coordinated. So for this purpose, you know, what we have in country, there was under the WHO leadership, there was what we call health cluster coordination, which was coordinating the humanitarian partners. Now we have extended the scope of this cluster coordination. We include the Sehat Mandi NGOs and partners, so at least the coordination of whatever we are doing Afghanistan in terms of service delivery and health services should not only NGOs, but also we invited other partners, NGOs and humanitarian UN agencies into this cluster coordination. From WHO side, in terms of providing additional staff. WHO is increasing our footprint in the countries to just ensure that not only international, but also sufficient qualified cadres. So we are recruiting more and more, so at least we will be able to deliver services. For the future, what there is a plan, I think some of our colleagues here in Europe will be invited, particularly KIT. What we are planning is to start with internal WHO UNICEF joint internal consultation next week for 2-3 days, where we want just to brainstorm together what should be the future of the health system in Afghanistan based on available information, and then reach out other stakeholders, including Afghan colleagues who have been working in the Sehat Mandis or in the Ministry of Health, and to find out a solution. I don't know, I don't have any solution to say this is what we will do, but we'll try to explore these 3 days brainstorming and to respond to different questions that you have, and then see how we can move forward. So again, thank you very much for these opportunities, and we're happy to respond to any questions if there is. Yeah, thank you.
Thank you, Dr. Camille. It seems you give us a glimmer of hope that at least things are happening at the moment as we speak. And good luck to you to get it all moving. It must be a massive task. And then we hope indeed that along the line some more things are possible. And that automatically brings me to our next and final speaker, Mrs. Mariette Schuurman. She's the Director of Stabilization and Humanitarian Assistance of the Dutch Ministry of Foreign Affairs and former Dutch Human Rights Ambassador. She was formerly assigned as the NATO Secretary General Special Representative for Women, Peace and Security. So that alone, this long title, provides already some clue points which we would like you to speak about. But of course also we think about you as a representative of an important donor, also with links with the European Union, which we think of. And I think the donorship is not only linked to money. By the way, we need at least 160 million euros or dollars to even maintain Sehat Mandi, and it will probably be more expensive by now. But also it's of course the field of international diplomacy, what can be done, how we could move, how we can create space to address the health system. So it's a lot to ask to you in only a few minutes' time, unfortunately.
Thank you, and I'm not sure if I can pay justice to all of that. And also, I think it's important to keep time for questions and answers, so not to fill up all the time. But thank you for allowing me to be part of this panel. It's good to see so many people calling in from different places on. I think what you said, Egbert, is really something very close to our heart. Afghanistan, whoever has been one way or the other involved in Afghanistan, has friends in Afghanistan. Sorry, I had to throw out a call. So I think we've all been deeply concerned and closely following what's happening there. And I think the important thing is really, as you said, how do we sustain the gains? We will not disengage. But we cannot afford a system collapse. But the critical question is really how. And we're closely in contact with our NGOs and partners in the Netherlands, but also, as you said, international players, multilateral organizations that are also where we're also part of. So the EU, the UN, the Red Cross, Red Crescent movement. Very intensive talks, not only on humanitarian aid, but particularly also on the medium to long term. So on the how, I think 3 tracks for us: humanitarian aid, assistance. We have, like everybody else, stepped up our humanitarian assistance with an additional 20 million euros for the Afghan Humanitarian Fund, on top of all the unearmarked funding, including through SURF, which is the UN Emergency Fund, which was the one that allocated early on 45 million to continue to support the health sector through UNICEF and WHO. So humanitarian aid, unfortunately, already before August, the humanitarian needs in Afghanistan went up, particularly because of the food security situation. And after the events, obviously, that's only further increasing. So we're following that. The other thing is to continue the support that we do through NGOs by finding ways, which NGOs that we have, local organizations, are still having capability to deliver, and how do we make sure that they are safe to deliver and continue that. So that's an ongoing discussion with our partners. And the third track, and that is the big question mark for now, is how do we continue the support that we used to have through the multilateral organizations that we're a member of for basic services. And there, so as I said, in the short term, we found solutions through the humanitarian system. But for us, this is not humanitarian assistance, and I'll come back to that because I think it's a critical notion to keep in mind that the humanitarian system can and should not fill the gap. And I'll come back to that, and it's close to my heart as a director of humanitarian assistance. I have to keep protecting the humanitarian space and be very strict on that. And then the medium term that we're working on now is, in the short term or for this year, indeed, a previous speaker alluded to that, how can we make sure that Sehat Mandi can continue through other channels? So to find a way through other channels to continue supporting basic services, particularly health and education, that we used to support through ARTF by finding other channels. But again, that's a temporary solution, and it's linked to conditions in order to make sure that the money obviously doesn't end up with the de facto Taliban government, leadership that is also not controlled and conditioned by the Taliban leadership, that all those who are in need have access to those services, but also all those who work in the sector can continue to work in the sector and are safe. And that's particularly obviously applies to female workers, female health staff. And finally, I mean, it's also important to have that conditionality in order to make sure that the Taliban does not legitimize itself through the support given by the international community, but also because we shouldn't let them off the hook. By taking over control of the country, they have a responsibility to deliver as well. So there's many moral dilemmas, and those particularly apply then to the longer term. So the very short term, we manage through humanitarian funding. The medium term till next year, we are close to finding, solutions to allow us to continue paying salaries, because I think that's a critical thing, as well as supplies. But for the longer term, we really have a challenge on how do we have a system-wide approach to continue basic services, to deliver, to support Afghan organizations, to deliver basic services without basically doing harm as an underlying, and now I'll try to keep it as simple as possible. Now, maybe the final note, as I said, humanitarian assistance is obviously only driven by the humanitarian imperative and humanitarian principles. So it's only for those most in need worldwide, and it can never be a system-wide approach. It's not a structural support for a very practical reason, because the money that we have in humanitarian assistance worldwide will never be enough to, in a structural way, in a sustainable way, support delivery of basic social services, also not in Afghanistan. And also because the system is not meant for that, because it's, for principled reasons, we cannot use humanitarian money. The little money that is there, the development money worldwide, is much bigger than the humanitarian money, and we cannot use that for a system-wide approach. So humanitarian assistance is only based on humanitarian imperative there where the need is the highest. And resources are limited. So it's life-saving only and not structural support. So that just as a note, maybe to the others that spoke before me. But I think really the question, as I said, is the how, and particularly for the medium term, I think we're very close to finding solutions. We didn't solve the financing issue, the cash issue, the fuel situation, the logistical issues. So that even if we find a channel, we manage to fix that. We still have a lot of operational challenges to fix. But the longer term is really the big, I say that, the biggest challenge, where we need a lot of creative thinking on how we find a way to structurally support health service delivery without legitimizing those that took power.
Thank you. I think you do highlight some of the dilemmas, which of course were all familiar to us in the room here, and even we cannot talk about the elephant in the room, but that's of course the big dilemma on how to move forward and find solutions for the longer term, which also the situation will change again, so this makes long-term planning even harder. What I would like to do is to call upon my colleague Barend, who has been collecting questions from the audience. And maybe you could put forward a few of the more pertinent questions which came through. We have some minutes left. We look to the organizers to know how many minutes we exactly have. They are in power. They are women in power there. So Barend, could you...
Yes, I think I can. This mic is working, huh? So you can hear me all. Yeah. There were already two questions during the presentation that I can use now also to ask to the panel. And I'll leave it up to you, Egbert, whom you like to really ask for a reaction. First one is of Paul van den Berg, Cordate. He asked, like, hey, why is it possible that donors like the Global Fund pledge for 1 month but not longer? And particularly also then the next question is interesting, is that because this might be perceived as a recognition or legitimization of the new regime? So that's maybe one. maybe next to it already another question from Martijn Vink, and he asked, like, would it be possible to continue funding the Afghan system, but at the same time to bypass MOPH, which is now run by Taliban? So really setting up actually a parallel system. And that remark comes back with several comments that I read in the chat. So maybe we'll take this first.
Yes, who feels particularly inclined to answer? I'm looking a bit at Dr. Majid, who may have the more immediate answer, but if any of the other panelists would like to follow him, then please, you're welcome.
Yeah, I think it is a question I have in mind, everybody has in the mind, how to make sure we are keeping the health system and health facilities in clinics functional, and the women and the children are not suffering. That is our priority as a non-governmental organization, as a humanitarian organization, and as an international community. But how that is funding is coming is still, we are not talking with Ministry of Public Health, not the government, and how it is should go. Nobody has the answer yet. But the banking system, the cash, and everything is now not, even with funding available, the system is not functioning. We don't have cash to pay salaries. We have in the bank, but there is no cash system. So that is, I think, needs international community with sanctions, with different limitation with banking system, with cash system, that there a solution is needed. I don't have an answer to that one. But sure, there is a need and there should be a solution. Otherwise, the crisis will be huge. That is what we are saying about 20,000 healthy staff we are talking about. We are talking 90% of people, they are accessing these health facilities, and also the poverty is going down. That out-of-pocket expenditure was in health was huge, but there is now nothing is possible by the people. So there should be a way in between. That is, the UN is working with WHO and UNDP and others. That there should be, that is the one of the mechanism that should be channeled, and that is the NGOs which are being active for last 3 decades, and that they can continue funding. But the legitimacy is another issue. That maybe it is more political, but there has been during 90s, there was funding coming to the Afghanistan, and there was NGOs without recognition of Taliban. And there has been some experience in post. We can look back to that one.
We have 2 minutes left.
Well, there's quite a strong reaction in the chat box going on now, and it's about sustaining the health system, because actually in the past 40 years it hasn't been sustainable. So how do we get at the point to make it sustainable? One of the remarks is like, is it time that donors create new financing streams that are not either humanitarian or development, but transitional, and have longer funding cycles and more funds than the purely humanitarian instruments? Ergo, actually, we're now seeing an emergency developing, and humanitarian aid is not yet the right source for funding. So we first need to have a further development for the emergency before we can pledge money into it. So there's a bit of a, what is called in here, a binary discussion also going on. So maybe please, that is maybe a nice question for Mariette to react on.
Yes, I would like to give Mariette the floor on this specific question, and I think also Pashtun also wanted to say something. So that's probably the last thing we can have, I think, unfortunately. So Mariette, could you say something about this, and then we have Pashtun to finish off our panel.
Yeah, I don't think we need anything between humanitarian and development money. This is talking development, but the thing is that we operate in a very volatile situation, and we can't do the kind of development assistance, structural support through the usual channels. So, and it has been done before, it has been done in other fragile situations. But my point is really, I think if you look at money, humanitarian funds globally is really peanuts compared to what is available for sustainable development. So everything that's structural should be funded from structural funds, but we really have to crack the nut and see how we can do that in a way that doesn't, let's say, even make stronger those that took over power. That's not unique, unfortunately, for Afghanistan. But it's very acute, and I think that makes this case unique.
Thank you. It's indeed very unique. For the panel, I would like to give the final word to Pashtun. You are muted. Pashtun, you are muted.
Just I wanted to suggest, as you know, the mothers are delivering babies, whoever is in the power, and midwives are there to support them. But how we support the midwives to support the women and families. So one of the strategy could be to channel some support through Afghan Midwives Association to establish midwife-led maternity care centers, which cover the continuum of care from the community midwife unit to the center, the midwife-led maternity care center, if needed, social level hospital. So one of the examples just yesterday, with the support of one of the not donors, one of the organized international community, they established one. And from 2 o'clock till this morning, they had 4 babies in that center. And the mothers and babies are safe and healthy. So since the Dutch government has 2 organizations, national, one CORDATE, another HealthNet TPO, that they know Afghan Midwives Association, they can channel the money. And as soon as they establish a few in in Kabul, they can scale up to the provinces. And I think we will cover that totally in few through that center. It was not a new idea. It was from 2012 we recommended Minister of Health. But in this critical situation, we tried from the last month to make it happen. And finally, we have that one. Actually, it is the second one, but the first one which was supported by another donor, it is the activity stopped by the moment, unfortunately. So this is one of the things that the Dutch government can support. They know Afghan Midwives Association as well as that to ensure that we have the experience of working with it. Thank you.
Yeah, thank you very much for these words. And frustrating as it almost always is, we have to finish the panel. We just started to scratch a bit, I feel, on the surface of raising some of the important issues, but unfortunately we need to stop here. We will try to capture what's been said here during the panel, but also during what we got in through the Q&A, and somehow distribute this to you so that we have to capture this session, which I think is in particular important to start raising the right questions. I think that's where we have been struggling with. Of course, we are very happy that at least certain things do happen, as particularly Dr. Camille told us. Also, quite a few things happening behind our screens, at least, as Mariette has alluded to. So there's some hopeful things, but there are so many questions unanswered that we had never had even the illusion that we could start answering them. But I think it did help to ask us to ask some of the right questions and see how we can move this forward and be of assistance and be of advocates for the situation. So I would like to thank our panel, the both gentlemen who are sitting here and the ones I see here at my screen in the distance. Thank you very much for your patience. Thank you very much for your contributions. We have all captured it, and we'll get back to it and think about it again.